Hello, my name is Shauna Miller, and I have the great privilege of being the President and CEO at North York General Foundation. I want to personally thank you for your gifts in supporting the most vital and pressing needs here at North York General Hospital. Those pressing needs this year were the funding of vital equipment and technology to care for the patients that we treat each day. I really want to bring you along and have our health professionals tell you how these pieces of equipment are supporting our care from birth throughout life. Hi, Rochelle. It's so nice to see you today. Thank you for taking the time out of your busy day to show our donors what they are supporting with their generous donations. So I hear we're here today with Gertrude, one of our sim mannequins that helps us from a teaching and learning perspective. And this is one of the pieces of equipment. Tell us a little bit about it.
This is a portable specialized bladder scanner that we received from the donations from the hospital, which is for sure is going to be very helpful on our behalf.
It looks very small, and it looks like you can bring it right to the patient's bed.
Yes, this is very, very convenient because we can take it from one room to another, and we can use it to multiple residents. So after we clean each session, then another resident's ready to use it again.
That's great. And why would you have to do a bladder scan on a patient like Gertrude?
Urinary retention is very, very common to elderly population. After they have surgery, post-op, and also when they are unfortunately suffering urinary tract infection, they will experience bladder retention.
And without this piece of machinery that could come right to their bedside, what would a patient like Gertrude have to do before you got this piece of equipment?
She might have to go to the emergency room because we don't have the capability to do the bladder scan and help her out with that.
So this is a big change, right? Rather than having to have an elderly patient transported by ambulance to our emerge, you're able to do this with this new piece of equipment.
Yes, it's going to be a great help for us.
Wow, that's amazing. Well, Rochelle, thank you for showing us. I'm so glad this machine is making a difference for your patients here at Seniors Health, and I thank you for taking your time. Have a great rest of your day.
Thank you, you too.
So nice to see you, Dr. Owen. Thanks for giving us your time today. Tell us what you do here at North York General.
Thanks for having me, Shauna. I'm one of the critical care physicians here and the medical director of our critical care unit.
That's great. And today our donors have helped support the purchase of new ventilators in our critical care unit. You've got one right here. Tell us what this machine does.
Well, a ventilator is a breathing machine that supports our patients when they are unable to breathe for themselves. So it essentially delivers a mixture of air and oxygen as well as pressure through a breathing tube, through the patient's windpipe into their lungs to, again, breathe for them when they're at their sickest.
And so what would a patient present with that would need a ventilator like this?
Often patients might have a severe pneumonia, such as a bacterial pneumonia or COVID, for example. They could have conditions like obstructive lung disease, or patients may not be aware enough to breathe on their own, where a ventilator would be useful to help those patients.
And through donations, you've upgraded your fleet of ventilators. What's great about this version of the ventilator that's better than the previous ones we had?
Well, this particular ventilator is one of the newest state-of-the-art ventilators that essentially allows for adaptive ventilation, meaning we can individualize the ventilator settings based on how hard the patient is breathing. So I think that makes it more comfortable for our patients while minimizing any sort of extra stress to the patient's body.
That's great. Wonderful. Well, thank you for taking us through this amazing piece of equipment that helps our patients, and thanks for everything you do.
Thank you, and thank you to the donors.
Once again, thank you so much for your generous support of North York General. As everyone knows, life can change in the blink of an eye, and we are grateful for your support of our hospital.